Yeah, good evening. Welcome to the Unacademy. And today we are talking about the FMG paper. And FMG 150, we basically talk about the questions that will be important while we learn about the topic. Okay. So, welcome students who have joined us and who will be watching us late. So, we at this platform, as I told you always, that at FMG the psychiatry is important because psychiatry is the topic, is a subject for which the MCQ, if you know the concept, the answer time is the 1 to 2 minutes, 1 to 2 seconds, sorry. So if you know the right answer, it will be the 1 to 2 seconds. So good evening, you can all join us and ask questions and enjoy. So we kept it like, how does we go about it, is that we taken a point to learn the subject from the previous year's MCQs. Good evening, Dr. Hema, and thank you so much again for joining in such a large number. So we start with the, welcome all of you. So we start with some MCQs of the FMG and then we'll take up the MCQs, saving time. So we start with the last 5 years topic so that we become the master of the last 6 years of the papers and topics. So we'll say previous year's topics rather than the previous year's MCQs. Good evening, Dr. Faisal, Dr. ZV, Dr. Gopal. So thank you so much. So we now come to the question that has been asked, that when should we go for the indoor management of anorexia nervosa on the priority patient with the, see, in anorexia, A, B or C or D? It is the weight for height less than 75% of the normal. We know anorexia nervosa usually less than 15 to 20% of the normal weight. So in the anorexia, the complication is by the, currently we know the complication is by the BMI. As per DSM-5, any BMI less than 17.5 kilogram per meter square is the anorexia nervosa. It's anorexia nervosa. Well done all of you. Somil Saab, it is, amenorrhea was the criteria, but in DSM-5 it has been removed. Even the weight percentage criteria has been removed, but we have classified now. So that's the criteria. Severe dehydration, electrolyte imbalance, significant weight loss, and behavior therapy, and treatment is the SSRI and the cyproheptadine. Okay. We now know that the, as per DSM-5, it is being classified as a, anorexia nervosa has been classified as mild, moderate, severe and the extreme. We say mild is BMI more than, less than 17.5 kilogram per meter square, but more than 17 kilogram per meter square. Moderate is 16 to 16.99 kilogram per meter square. Severe is so any weight less than, extreme will be the less than 15 PMI. Okay, that's great. Now disulfiram is a type of disulfiram. We know it's popularly used drug in the alcohol, and it acts by blocking the enzyme, blocks acetyl dehydrogenase, and it cause the aversion reaction to the alcohol. Aversion matlab, if you block this, there will be a palpitation, there will be a nausea, vomiting, redness of the face, gastritis, diarrhea. So instead of the pleasure, I will have all these symptoms when I take alcohol. Anti-craving are basically, so detoxification is done by the benzodiazepine. Drug like alcohol are used in the sedation of the alcohol withdrawal. Anti-craving drug are the long list now being asked very popularly. Acamprosate, topiramate, baclofen. So alcohol is a illness now. Fluoxetine, gabapentin, naltrexone. So these are the anti-craving drug for the alcohol. For detoxification, we use a drug like alcohol, and aversion is by this. ठीक है डॉक्टर साहब. So disulfiram, we say alcohol derived acetaldehyde can't be oxidized and leading to the flushing, headache, palpitation, tachypnea, hypotension, tachycardia, giddiness, impending doom with severe anxiety. Bad consequences, it's aversion or the aversion therapy. Now detoxification is basically, we usually use the drug like alcohol, that is benzodiazepine, and that's a list of the anti-craving drugs. That's a list of the anti-craving drugs for the alcohol. Now non-diabetic, non-hypertensive patient, extra beat in the pulse. Doctor tells that it's a normal, but the patient is going further for the investigation from doctor to doctor. We know it's a well done, Dr. Indu Gopal, Dr. Somil. It's a hypochondriasis. We know in this no or minimal pathology, either no pathology or minimal pathology is taken as a sign of a deadly disease. Very good. Whereas in factitious disorder, there is a, the patient fakeful production of medical symptoms for some gain is being called as the malingering. Sorry. It's not for some gain, it's getting the medical attention. For some gain, it's a malingering. For getting medical attention. So in convergent, the unconscious mind takes over the conscious, and there are multiple unique symptoms for which there is no cause can be found out. That's a convergent disorder. Thank you so much, Dr. Sir. We'll do the more special live class short while. So that's a hypochondriasis. And as per DSM-5, the question they may ask you now is very simple. It is being called as the illness anxiety disorder. So nowadays there is no confusion. As per DSM-5, the nomenclature is very simple and clear. It says it's a illness anxiety disorder. So it's a illness anxiety disorder. Okay. So it's basically not a delusion, but it's a overvalued idea. But we'll not go into the terms like all this, but we just say it's a minimal or no pathology is taken as a sign of a deadly disease. Convergent disorder, we all know it's a presence of symptoms or deficit affecting the motor or sensory function, suggesting a medical or the neurological disorder. It's a sudden onset and usually in the presence of psychosocial stressor. Okay. And there is a clear temporal relationship between the stressor and the development or exacerbation of the symptom. And please mind, patient does not intentionally produce the symptom. Symptoms are not produced intentionally. There is an unconscious pathway leading to the symptom production. Yeah. So convergent disorder remain the convergent disorder in DSM-5. So DSM-5 for again the same name, and also for the factitious disorder the name is same. So whether DSM-4 or 5, same name. Okay. Somatoform pain disorder and somatization disorder. As per DSM-5, they are now being called as the somatic symptom disorder. They are now being called as the somatic symptom disorder. ठीक है डॉक्टर साहब? Okay, let's do the next question. 6-year-old child who doesn't interact with anybody and prefers playing alone in the same manner. He is suffering from a autism. We know there is a lack of the reciprocal social communication and stereotypy movements. Some abnormal movement. Previously they say language is also absent, but that will be the B. We know DMDD is a disruptive mood dysregulation disorder. ODD is the oppositional defiant disorder. ठीक है जी. Okay. Again, absent social smile, lack of the eye-to-eye contact, awareness of the other existence feeling, treat people as a furniture, lack of awareness. So, prefer solitary game, marked impairment in the making friends, lack of the imitative behavior, and absence of fear in the presence of danger. So, that's all is a feature of the autism. Now, we come to the 18. Not a feature of the fundamental symptom of the schizophrenia. Autism, automatism, ambivalence and associational loosening. बताइए डॉक्टर साहब. We know that Eugene Bleuler coined the term schizophrenia and given the 4 A's of schizophrenia, namely autism, ambivalence, affective blunting, and associational loosening. So it's a automatism which is not there. That's not a fundamental feature. It's a automatism. Automatism, we all know, it's a motor aura. Before epilepsy, some twitching of the mouth, some blinking of the eyes is being called as the automatism. 4 A's, very good. So it's not the autism, it's a automatism which is not there. It is seen in the before epilepsy. So before seizure there is some movement of the mouth, some blinking of the eyes. That is what has been called as the automatism. Again, the same question of 2017 again comes up. Spends her time seeing her own hands and does not interact with anybody. It's a autism. So B is correct. Yes, very good. So for the automatism is not the answer. Okay. Now we come to this girl. Again, the normal language milestone. Seeing her own hands and does not interact with anybody. Likely diagnosis is. It's a autism. Very good. Double depression is. बताइए डॉक्टर साहब. Double depression is a depression on dysthymia. It's B. So somebody, dysthymia is a subsyndromal depressive symptom for 2 years. Subsyndromal depressive symptoms for 2 years is being called as the dysthymia. Okay. Now somebody really become depressed, that will be called as the depression on dysthymia. Okay. Now medico-surgical patient, the most common psychiatric illness is. बताइए डॉक्टर साहब. It's a acute confusional state. It's a delirium. Delirium and dementia. The latest question can be asked. The chemical responsible is choline. So lack of choline lead to the. So well done, Dr. Indu Gopal, Farahat, Dr. Medis. Here it's a delirium. So depression we know is the most common psychiatric illness in India is depression. The most common psychiatric illness in world is. So देखो डॉक्टर साहब, answer is anxiety. So they are very particular. So they have asked you the world, the answer will be anxiety. They asked you the India, the depression, the answer will be the. They asked the India, the most common psychiatric illness, the answer will be the depression. But the psychiatric illness commonly in the medico-surgical patient is the delirium. And the chemical lag in the delirium dementia is the choline. Very good. So that's the latest question they could have. Again, the most common acute organic mental disorder is, again the answer is delirium. So that's a delirium we all know is a acute confusional state. In this, it can happen by n number of causes: hypoxia, hypercarbria, poisoning, toxins, electrolyte imbalance, burn patient, hypoxia, less temperature, more temperature. There are n number of causes leading to the acute confusional state called as the delirium. And by any cause delirium happens, we all know there is a diffuse EEG slowing. By any cause delirium happening, there will be a diffuse EEG slowing. And in this we have the orientation is impaired. The first point is orientation is impaired. The person is not oriented to the time, place and person. And there is a hallucination. We know in the organic condition it has to be a visual hallucination. There is a transient delusion. Delusions are transient in nature. There is a reversal of the sleep-wake cycle. Whatever my sleep-wake pattern was, that has been reversed. And there is a sundowning phenomenon. The moment the sun sets up, there is a worsening of symptom. And there is a either hyper or hypokinesia. There is a picking behavior called as flocculations. Treatment is treat the cause, and till the time you treat the cause, you give the injection haloperidol 1.5 milligram IM or IV. ठीक है डॉक्टर साहब. Okay. Now we come to the FMG 2019. Very loving question. There is a lady come with a sudden onset of chest pain, palpitation, lasting for about 20 minutes. She says there were 3 similar episodes in the past. All investigations were normal. Panic attack. Panic attack, we all know, is a sudden, severe, spontaneous attack of anxiety. Building up in 10 minutes. Lasting for half an hour. With a feeling of impending doom. Either I die or I'll go crazy. That's a panic attack. And treatment of panic attack is benzodiazepine. Now all are the stress reaction stages. We know Elizabeth Kubler-Ross said that whenever somebody experiences a problem in the life, he go to Dabada. Dabda is denial. No, 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 I can't have cancer. Anger with the God. Then bargain. Depression and the acceptance. So that's a, so agitation is not there, it's a anger. So they are so naughty, they are so, they want you to know, because you remember the Dabda. So we just mess it up. Okay. Similarly, they make a, to how to break a bad news. We have another short form. Bad news कैसे break करते हैं? By the, I forgot. बताइए डॉक्टर साहब. Very loving MCQ of the FMG. How to break a bad news, and it's a, oh my God. Now, which of the following is not a formal thought disorder? Now we know delusion is a disorder of the content of thought. Obsession is a disorder of the possession of thought. So, lithium dekhe, okay. Content. So this is all is the disorder of the formal thought disorder. Now disorder of the form of thought. Okay. That's a tendentiality loosening neologism. ठीक है डॉक्टर साहब. Now to PTSD, the symptom must be there for more than 1 month, 3 months, 6 months. We all know less than 1 month is being called as the acute stress reaction. More than 1 month is PTSD. More than 6 months is chronic PTSD. Okay. Now symptoms are repetitive dreams, reliving experiences, illusion, flashback phenomena, then we have the anybody experiencing this all, he will be in a numbing state, shocking state, he or she will be hyper alert. Numbing state, shocking state, hyper alert, and since that time there is a avoidance of those places or situation. So 3 component: repetition, emotional reaction, and avoidance. So symptom cluster after the post-traumatic is this. Okay. Okay. Now fear of places from where the easy escape is difficult. It's been called as the, in psychiatry, see in English we say claustrophobia as a fear of closed spaces, and we say it's a acrophobia as a fear of heights, of dark places, closed spaces. Agoraphobia in English is a fear of open spaces. But in psychiatry, it's the same. Fear of places from where the easy escape is difficult. It could be closed, open, height, dark, or anything. Well done, Dr. Deepak Raja and Dr. Somil. Neologism is a hallmark finding for. Neologism, we all know, is a coining of new words or using old words in a unique way. That's a neologism. We know that is the classical symptom, the most characteristic of, it's a most characteristic formal thought disorder of schizophrenia. So we say that neologism is seen in the schizophrenia and dementia also. At time in dementia we can also have the neologism. ठीक है डॉक्टर साहब? Okay. Now delivery हुआ है, 2 weeks mild symptom after delivery which disappear within 2 weeks. It's called as the postpartum blues. सब लोग चले गए हैं. ब्लूज डिप्रेशन नहीं कहेंगे डॉक्टर साहब. सी इट इम्प्रूव विच डिसअपियर्स विद इन 2 weeks. माइल्ड डिप्रेसिव सिम्टम्स हैं तो इट्स अ पोस्टपार्टम ब्लूज. इट्स अ बी. ओके, वेल डन ऑल ऑफ यू. दैट्स ग्रेट. Double depression is again repeat, it's a depression on dysthymia. Now we come to the alcoholic world of the psychiatry. Visual hallucination, disorientation, chronic user of alcohol, and last intake was 2 days back. What is the likely diagnosis? So we know that hallucinosis comes in 6 to 8 hours. It's alcohol withdrawal delirium. So it has been called as the delirium tremens. Delirium tremens. Okay. So that's a sequence. We have tremors, nausea, vomiting, sweating, and so we have now the iconic subscription. I just couldn't load those. So we have mentoring session and the Unacademy Plus. And we have the notes also. So notes plus question bank plus all for 6 months it is 24,700. 9 months is for 26,600. 1 year it's 28,000. 2 year it's 32,000. And 2 years is 38,000. 4 years it's 45,600 rupees. So pay less, get more. There is an iconic subscription for 26,000 you can get for 9 plus 2 months. So anybody interested can also go. That's prices are being slashed. I'm sorry, slides can't be loaded up, but we are coming up with the iconic subscription. It's a plus notes plus question bank and all. So that's a seizures comes in 24 to 48 hours and delirium happens in 48 to 72 hours. So that's how is the Very good. So not open this. Yes. Now excessive cheerfulness. That's a classical symptom, Doctor Sir. Excessive happy है, increase activity levels है, excessive talking, lack of sleep for 10 days. What is the treatment of choice in this case? Means it's a simple question. Treatment of choice of acute mania. The answer falls for the lithium. Seven days के लिए question session. Okay. I'll speak to the management tomorrow and hopefully we'll do something like this for you. Okay. So we know that drug of choice for acute mania is the lithium. Lithium is a drug which is a classical case, which has a narrow therapeutic range. Therapeutic level is 0.8 to 1.2 milliequivalent per liter. Prophylactic level is 0.5 to 0.8 milliequivalent per liter. And anything more than 1.5 milliequivalent per liter is a toxicity. So recently there are a lot of MCQs about the lithium side effect and toxicity. Side effect, we have the fine tremors, we have the diabetes insipidus, we have the hypothyroidism. Toxicity, we have the coarse tremors, we have ataxia, nystagmus, seizure, coma and death. Very good, doctor. So that is the brief about the lithium, because they are asking a lot of MCQs about the lithium these days. Yeah. Okay. Now that's a question you all remember. Yeah, below. So girl suspecting that the college principal is making some conspiracy against her and is planning to fail her in the upcoming exam. She feels that the other teachers also have joined the conspiracy. It's a delusion of the Othello Syndrome, reference delusion, grandiose delusion, or delusion of the persecution. It's a delusion of the persecution. Very good. Grandiose means big talks, big claims. Grandiose means big talks, big claims. Somebody wants to harm me, kill me is a okay. Reference is that something special meaning to self. Delusion of infidelity. Delusion of the infidelity. Othello Syndrome. Okay. So thank you again for joining in such a large number once again, and that's again. Boy brought to child psychiatrist by the parents. Parents reported child is having a lies frequently. So that's a misbehave with the teachers, often bullies younger kid and has been stealing money. We know lying, stealing, robbery, misbehaving, is a classical of a, since it's a boy, we can't say it's a personality disorder, it's a conduct disorder. It's a conduct disorder. Very good. Dr. Sanjay Nain. Okay. Well done, Dr. Hema. Dr. Upadhyay. So it's a conduct disorder, we know. In oppositional defiant disorder, they does exactly opposite of what is being told. Instead of obeying the order, they defy the order. They throw temper tantrum. They know how to irritate parents, they irritate the parents. But here in the conduct disorder, they basically lying. Along with this all, they are lying, stealing, robbery, substance use, setting fire, missing from home. That's a conduct disorder. Now, after 18 years of age, what it will be called is a antisocial. Same thing will be called as the antisocial personality disorder. ठीक है डॉक्टर साहब, well done. Again, recent history of divorce, palpitation, sweating, heaviness. देखिए एक ही बात को they have just asked us the panic attack in the last exam. Now panic attack they are asking you in a language form. Multiple similar episode in the past few weeks. Blood tests are normal, and in the past also the investigation revealed no abnormality. What is the next best step? Admit as per the corporate choice, but that's not the right answer. We have just learned beta blocker nahi dete doctor sahab. No. We have just learned that for panic attack the answer is benzodiazepine. For panic attack the answer is the benzodiazepine. It's a panic attack. Well done, Dr. Sanjay Nayan, Hema, and Dr. Farah, and Dr. Deepak Raja, and all in one. Well done. Very good. Now, excessive fear of getting contaminated, repetitive washing, checking, excessive doubts are the feature of a obsessive compulsive disorder. And related disorders. Now, as per DSM-5, it has been called as the OCD and the related disorder. In this, we have OCD, we have hoarding disorder. I keep on hoarding things. We have a body dysmorphic disorder. We have the trichotillomania. Previous impulse control disorder now been kept here. And last we have the skin excoriation syndrome. Excoriation syndrome. As per the ICD-11, we have added the olfactory reference syndrome. That's a new addition. And we have the hypochondriasis also come up here. That's how we'll do 2 special classes, maybe Monday and Wednesday. So when is the exam? I think एग्जाम कब है डॉक्टर साहब? आवाज बहुत लेट जा रहा है लगता है. 30th, yes. So then I think we have to wind up Sunday, yes. So we'll do it on maybe Monday, and then on any doubt clearing session on maybe Wednesday, but Monday should do. Okay. Now that's a long history. All story. There is a man reports after a sudden financial loss, he developed a certain symptom. Feeling fearful that someone is about to harm him. He couldn't eat or sleep properly. He also began to hear voices of female and voices would abuse him. Say that he was a useless man, should kill himself. So it's a acute psychosis. No relevant past history of drug abuse or medical history. The most likely diagnosis is the schizophrenia फॉर्म नहीं है डॉक्टर साहब ये. नॉट हॉलीडे मतलब संडे हॉलीडे नहीं है. It's a acute psychosis. We know any hallucination, any delusion less than 1 month is acute psychosis. More than 6 months is schizophrenia. And between 1 to 6 months, it's a schizophreniform disorder. Hello, Bhatti Saab, आइए. So we have been enjoying the previous year's MCQ of FMG or maybe the psychiatry. We can keep on tomorrow also if you say. Some more FMG MCQ we can keep tomorrow 10:30 p.m. to 11:30 p.m. to finish off more learning. Okay. So it's a 1 week. Symptoms stop हो गए. So we can't say it's anything, but it's a acute psychosis. Okay. Excessive concern with the physical appearance, inappropriately seductive, shallow labile affect, self-centered and acting dramatically. So inappropriate appearance, dramatic is a feature of a histrionic. So they want to be the center of attraction or center of attention. Borderline is a paranoid is a शक्की स्वभाव के लोग, suspicious people, and it's a unclear self image and goals. ठीक है डॉक्टर साहब. Now, hypochondriasis in DSM-5 is called as, we have learned, it is called as the illness anxiety disorder. ठीक है डॉक्टर साहब. Now, antidepressant used for the tobacco dependence syndrome. Tobacco, we know it's a NDRI. Tobacco increases the dopamine in the brain. Vanilla vaccine is a SNRI. It is SNRI. It's a SSRI. So it's a noradrenergic dopamine reuptake inhibitor. Serotonin noradrenaline reuptake inhibitor. Same. And it's SSRI. So answer is the bupropion. Well done. So nicotine causes the addiction. Nicotine increase the choline and dopamine level in the brain. So when I don't take nicotine, the craving comes by the demand for the dopamine and the choline. So we can give the bupropion that will take care of the craving. And tobacco dependence syndrome, we use this. And venlafaxine, देखिए, next time recently they ask you SNRI antidepressant is, the answer was venlafaxine. SNRI antidepressant is the venlafaxine. So treatment of insomnia. So shall we do it on Monday or Sunday? We can do a special class 10:30 p.m. again tomorrow and learn more of MCQ for FMG. So shall we do it tomorrow or Monday? 10:30 p.m. whichever day you say. बताओ डॉक्टर साहब. Tomorrow is Sunday. 10:30 to 11:30 p.m. Okay. Insomnia, we use the melatonin. For depression, adjunct treatment, thyroxine. Tomorrow, Sunday break day, hard work exercise. Okay. So कल ही करते हैं डॉक्टर साहब. If any topic you remember, we can always plan for Monday. So we'll fix up a special class maybe tomorrow, 10:30 p.m. Melatonin, very good. Anesthetic agent, that's a latest of development which has been used in treatment of severe depression, is the ketamine. Anesthetic, tomorrow we'll keep it, Dr. Saab. So tomorrow 10:30 p.m. to 11:30 p.m. again FMGE MCQ. Yeah. Now that's a difficult one. So the most common depressive symptom which is most commonly associated with the suicidal gesture is the hopelessness. So guilt, sin, they are all, but if I lose my hope, so in depression we say that hope should never be lost. It's a hopelessness which is the very difficult. If it is there, it lead to a suicidal gestures. ठीक है. Now reversible dementia, डॉक्टर साहब बड़ा मुश्किल सवाल है ये, लग आसान रहा है. Caused by deficiency of, बहुत फंस जाएंगे देखिए. Reversible dementia caused by deficiency of thiamine, ascorbic acid, niacin, pantothenic acid. फंस गए सब लोग, फंस गए हैं. देखिए, थायमिन कॉज दी इरिवर्सिबल मेमोरी लॉस. डॉक्टर साहब कोर्सोकॉफ साइकोसिस होता है. नियासिन, विटामिन B12, फॉलिक एसिड डेफिशिएंसी कॉज दी रिवर्सिबल डिमेंशिया. So we all talked about vitamin B12 and folic acid. Niacin was left. Thiamine deficiency happened in chronic alcoholic and dialysis patient and in the hyperemesis gravidarum, but it caused the irreversible memory loss. So answer is the C. 5 ways of negative symptom were proposed by. Please be very careful. It's not the 4 A's, it's a 5 A's of negative symptom. Negative symptoms and positive symptom concept has been given by Bleuler, has given the term schizophrenia. Amitriptyline, dementia precox. Schneider gives the first rank symptoms of schizophrenia. Nancy Anderson, positive and negative symptom of schizophrenia. B complex दे सकते हैं. This one, thiamine deficiency, no. We have to B complex जो होता है डॉक्टर साहब, उसमें कॉम्प्लेक्स होता है, बड़ा all B1, B2, B3, B4 in a very, very nominal, minimal quantity. For this thiamine, we need to treat, or what is being called as the Korsakoff psychosis. We need to give the thiamine in a IV and 100 milligram BD dose. Okay. Okay जी. नियासिन नहीं B3 तो है, लेकिन the dose is less. We have to use the loading dose. We have to use the specific vitamin, because in the complex the percentage are very less. So thiamine is the 10 mg. We need 200 mg. Vitamin B12 is, I think, 200 microgram. We need 1500 microgram if at all I am having a dementia because of that. So positive, negative and the cognitive symptom of schizophrenia given by the Nancy Anderson. Again, we have learned this, that which of the following is being less chemical in the delirium. It's a acetylcholine. We just learned it. So depressive equivalent are all except the pyromania. So dissociation, chronic pain, drug abuse dependence, they are all being taken as a sign of a depressive equivalent. Okay, there's something like depression manifesting in a drug form, pain and so on. Encephalopathia is after 4 years and nocturnal anorexia after 5 years of age. ठीक है डॉक्टर साहब. Cluster C personality. I just do this was last question. Cluster C personality include all except the. So we know we have cluster A, B, C. Cluster A is the odd and eccentric. By this table it will be done. It's a narcissistic. Well done, Dr. Ahmed, Dr. All-in-One. And yes, odd and eccentric, attention seeking, anxious. We have paranoid PD. We have schizoid PD. We have the schizotypal personality disorder. Here we have the narcissistic PD. We have the antisocial PD. We have histrionic PD and borderline PD. Here we have the anxious avoidant. We have the dependent PD and we have the anancastic, or what is being called as the obsessive compulsive personality disorder. ठीक है डॉक्टर साहब. So with this I think we take a break from you. So, a tricky question. All of the following are the negative symptom. Ambivalence is not there. Ambivalence is not able to decide for or against. We know amotivation, avolia, apathy, asociality, alogia, attentional deficit and affective blunting. They are the negative symptom of schizophrenia. I am good, Dr. Saab. Tomorrow we meet at 10:30 again with more of the FMGE MCQ latest 21-22. Thank you so much for joining with us with this. For hypomania, we have the last question. 4 days. Mania 7 days. 14 days is the depression. Good night. So see you tomorrow at 10:30 p.m. with more of MCQs. Till then, good night. Please come with any doubts, clarification. Thank you.